What if I told you a significant portion of the US population was automatically getting subpar care, and trying to give them better care might cut into your own care, and no one was talking about it? What I'm talking about is dealing with patients who are not able to speak English. Now, I know a lot of people, debate heavily over, immigration, things like that, and I really don't want to go into that. This is strictly clinical, but as many know, us doctors have very limited time with patients. Our appointments are 10-15 minutes max, and we're always rushed. We're always having packed schedules, and you know how rushed your doctor visit is. Now, imagine if your rush doctor visit requires you to use a translating device to communicate with your doctor. That's a mess, isn't it? It can double the time of the appointment, but obviously don't have that. As a result, those who do not speak English and need translation services are in a bit of a tough spot. They'll oftentimes have even more rushed visits because now you're spending half the time just trying to communicate and work with this translating device, and that gives even less time for them, so they're getting even more rushed appointments. Or if you try to give them the time that they need, their appointments end up taking even longer, which sets the doctor behind and means that other patients have to either wait or their appointments are rushed. Nobody really wins here, and I do worry that it compromises the care that those who cannot speak English get when they see their doctor. On top of it, I've had multiple people who are native speakers and can speak both languages and they can understand things like Spanish tell me that those translating devices are not always accurate. The translators on the phone will oftentimes totally say something different from what the doctor is saying and not translate properly, and it's very inconsistent. So even when you use these translation devices, it's not a guarantee that you're getting the information you need to the patient or vice versa, or that they're getting the best care. And that's not even accounting for the fact that these translation devices often have technical failures. If the Wi-Fi is bad, if the connection's bad, if there's a child crying and screaming in the room because you're a pediatrician and you can't hear the translator, what do you do? It's really a travesty that we do not have anything better for situations like this, because it compromises everyone's care. And a lot of people will say, well, we could just allow for longer appointment times for those who don't speak English. And I think that's a great idea. But in a time where there's a shortage of doctors and there's not enough appointments to accommodate all the patients that we need to see, that might mean more patients getting turned away and not having a doctor to see in the first place.